Scope of practice as a sports massage therapist. Within this presentation, we will look at what scope of practice is for sports massage and sports massage therapy. We'll look at contraindications as an overview. We talk about contraindications within all of the anatomy modules and also in the live training days as well. And this also gives you an overview that you can link back with your theory handbook. And then lastly, we'll talk about communication, which is communicating with your clients and other health professionals. Contraindications.
Cautions versus contraindications. So a caution is a situation in which a massage therapist may proceed with the treatment but will need to modify certain techniques in the light of the client's condition. For example, using lighter pressure or refraining from using certain techniques in certain parts of the body. A local contraindication is a situation in which a local area of the client's body should not be massaged under any circumstances. This could be for the client's own comfort, to avoid spreading infection, or to avoid further injury. And then the total and systemic contraindications is a situation in which no massage at all is appropriate. This is usually for reasons of protection therapists and also safety for the client. Now, here are the main local contraindications that you may experience and see in your clinic and what to do about it. As part of your anatomy and physiology modules, you've gone through a lot of these in detail related to each part of the body. But here is what you can do practically in terms of when you see these in your practice or whether you've spoken to your clients beforehand and you need to refer on. So the first one is bone injuries. So examples may be fractures. So in terms of treatment, it's a main local contraindication, so we need to avoid that particular area. So as an example, if they have fractured their tibia, we would avoid their leg. But what we can do is work on compensatory areas. So if your client has come in with a fractured tibia, they're going to be using crutches most likely. So if they're using crutches, there's going to be a lot more pressure on their upper body in terms of upper traps, biceps, shoulders, forearms. So what else is going on? They might be supporting themselves quite a lot with their upper body. So look for signs of tension, restriction, tightness in the muscles and other parts of the body. Next is acute musculoskeletal injuries and bursitis. So these might be muscle strains, ligament sprains. So firstly, look for visible signs of inflammation. So if your client has come to you and they are presenting with an acute musculoskeletal injury, then firstly, always refer on. So work with that local clinician, someone that can help with acute injuries, and refer on to get some help. So we avoid the area, but what we can do is again work on the compensatory issues. So if someone's come in with a gastric nemus or soleus strain, so a calf strain, then what are they doing on the rest of the body? So they might be leaning further to the opposite side, so they might be experiencing tightness or restriction in the opposite hip, or the opposite leg is going to be doing a lot more work. So you can look at those other compensatory patterns of dysfunction and you can use your massage techniques on there. The next one is skeletal diseases, so things such as osteoporosis, osteopenia. So these, you want to modify your pressure of massage, avoid bony prominences during that time, especially in certain flare-ups as well. And lastly, on this page, varicose veins, and you want to avoid any varicose veins, so any areas where you can see the veins, they're risen from the skin, you want to avoid that area. The next local contraindication are joint problems such as osteoarthritis or rheumatoid arthritis. Again, you've got a lot more information about the pathology of these in your anatomy and physiology modules. But in terms of treatment, you want to avoid the area if it's acute or there is a flare-up from the rheumatoid arthritis. You need to think about extra pillows and bolsters to modify and support certain affected joints. And again, adjust your massage pressure so it's comfortable for the client. The next one is skin disorders, so congenital and bacterial skin disorders. So firstly, avoid the area if it's a local contraindication, so avoid that area where that is affected. Apart from impetigo, which is a bacterial skin disorder, which is a systemic contraindication, so you need to refer on. But if it is bacterial and it's a local contraindication, so you can massage them, you want to be finding out what else is going on in their system. So there might be other things that aren't working as well. So they want to refer on to somebody else to get them some more help. The next is viral infections such as cold sores and athlete's foot. So it's a local contraindication, so you want to avoid the area, but again, think about what else is going on in the system. The next is open wounds, so blisters, cuts. Avoid area, but also ask them how are they healing, how long has that blister or that graze been there. And here are some examples of contraindications. So the first in the top left is a fungal nail infection. So if you see a client that has this discoloration, this thickening of the toe, if in terms of massage through clothing, so through socks, or avoid the area altogether. And it's also important to have a chat with the client and ask them if they know about their nails and send them to someone, so maybe a chiropodist that can help with that. The next on top right is the red spots are signs of folliculitis, which is an aggravation of the follicles in the hair. So if you have a client that has that, you want to avoid that area and add extra lotion. At the bottom here, you've got varicose vein. This is one example of varicose vein. Some of them may just be discoloured and slightly more blue, and some may be raised. So again, we avoid this area for massage. And lastly is a cold sore just here. There's a sign of infection, so you want to avoid any areas that have any cold sore. The next slide is the main systemic contraindications and red flags. A red flag is a sign or symptom that you may see or your client has told you over the phone that you know that they need to get some immediate medical attention, so to their GP or potentially to A&E. So in terms of main systemic contraindications, the first one is infectious diseases. So this covers things such as chickenpox, shingles, conjunctivitis, mumps, ringworm, tonsillitis. And these are very common, and it's not very common that your client will call up and book a massage in when they're experiencing any of these. But if they do, and they've told you any signs or symptoms, they may have a fever with this, with some of these, or just feeling under the weather, or a visible rash, then you need to get them referred back to their GP if they haven't already been, but you cannot massage them. It's a systemic contraindication. The next is under the influence of alcohol or drugs. Now, you may think this one is a strange one, but this can happen at sporting events, so running events or cycling events where they finish their race and they have a few beers at the end and then want to come for a post-event massage. So again, it's a main systemic contraindication, so you say no, they cannot have a massage with you because they're going to be quite dehydrated from the event, but also under the influence of alcohol, and it also affects the brain communication pathways. So in this scenario, they often need lots of water, some food, and to be sent home. The next is deep vein thrombosis, so DVT, or calf pain. So if you have a client that is experiencing some calf pain, if there's either a history of thrombosis in the family or within themselves, or there's no history of any injury, and the person may have just come off a long distance flight. So again, they need to go to, it's a red flag, they need to get emergency medical attention. So call their GP straight away or potentially go to A&E. The next is haemophilia and blood disorders. So haemophilia is where there's no clotting of the blood, and we've gone through this a lot more in the anatomy and physiology slides. But if there's no clotting, then in terms of healing time, that can take a lot longer, and we don't want to be affecting any healing in terms of what we're doing in massage. So it's a completely systemic contraindication. Bleeding. Very straightforward. If someone is bleeding, something has happened, they need to get some medical attention. So we do not want to be massaging that person. Fever. So if someone's feeling under the weather, they may have cold, flu, they've got a fever. One, you want to ask them a couple of questions to see if they have potentially an infectious disease that you can refer them on. But if they are feeling under the weather, the chances are they need to be rested. They don't need to be having a massage, so always refer on. The next is uncontrolled diabetes, and it's a question you need to ask on your consultation form. And the condition itself isn't a contraindication, but what is a systemic contraindication is if the condition is uncontrolled. So you want to have the chat with your client about the medication that they're taking, and to find out if they've been hypoglycemic or hyperglycemic quite recently. If they've been hypoglycemic, where their blood sugars have got too low, that can cause symptoms such as feeling tired, dizzy, feeling sick. They might become unconscious. Hyperglycemic, which is too much blood sugar, can cause tiredness, lethargy, extreme thirst, passing urination quite frequently. So have that chat with them first of all. Another thing that you want to be thinking about is the quality of their tissue. So if it's controlled diabetes and they've got good quality tissue and the circulation system is working well, then massage is absolutely fine. But if it's not, you want to check for changes in their tissues. You want to look for things like what the feet are. And there's something called diabetic neuropathy, where the nerve endings in the feet become damaged and they won't feel if they've had cuts or blisters or things like that. Alongside that is blood flow to the feet is also reduced, which creates poor healing. So if you're working with a client who is diabetic, find out about their feet and what's going on. The next one is uncontrolled hypertension. So hypertension is high blood pressure. And most of the time, most clients that are experiencing high blood pressure have had it controlled. They're taking the medication from their GP. But if it's uncontrolled, you need to get them to their GP as soon as they can. The next two are anything that's unexplained and undiagnosed in terms of lumps, swelling, bruising, edema, pain, or moles and sores that do not heal. So anything that you're not sure about and the client isn't sure about, have that question with them, get them referred on to their GP. The next set of systemic contraindications are related to the lower legs. If your client has mentioned or experiencing pins and needles or numbness between the legs or around the pelvic region, a recent onset of bladder and bowel dysfunction, or major motor weakness and widespread or progressive motor weakness, these are absolute contraindications and can imply cauda equina compression. Now, cauda equina impression is where the nerves around the base of the pelvis, in an area called the cauda equina, can become compressed for whatever different reason. So if your client is experiencing any of those, they need to go to their GP as soon as possible or potentially to A&E. Another contraindication is any severe trauma, excluding fractures and dislocations. So if your client has been in a car accident, for example, they shouldn't be coming to see you. They should be going to the emergency to get emergency care from their GP or from the hospital. If they've had fractures and dislocations, then we can work on other areas of the body, but not on that particular area. And the last one, if the client is complaining of a very severe pain radiating down both legs, it doesn't change with movement in any way, send them to get some help, because again, that can relate to some cauda equina compression or issues with the nerves from the spinal cord. The next condition to discuss is hypermobility. Hypermobility is where joints have an increased range of movement due to a laxity of the ligaments and connective tissues around the joint. It's usually assessed by a series of tests called the Baton scale. And you might see clients that have hyperextension at the knee, hyperextension of the elbow, or drawing the thumb back to the forearm. Other conditions which are connected to hypermobility are Marfan's and Ehlers-Danlos syndrome. Clients with either of these disorders produce a faulty connective tissue substance, either fibroblast, collagen, or ground substance. And this dysfunction causes the tissues to have limited tensegrity of the connective tissue, and which can't support the body's structure. So you might find that client can lift their skin quite freely away from their tissues. Clients with hypermobility may often complain with tightness in muscles, even though they have an excellent range of movement. Hypermobility and massage. Massage can have some really great effects on hypermobile clients. Benefits may be decreased tone of hypertonic muscles, improved proprioception, and decreased sensitivity and pain reduction. It's important to support the client's joints with appropriate bolstering and not take joints to end of range with techniques such as STR and METs. One note is that hypermobile clients may have decreased proprioception due to the laxity of the ligaments, and it's important to refer them to a qualified exercise professional to help them with movement re-education. These aren't contraindications, but you must get qualified to practice and work with these types of clients. So again, cancer can be very good in terms of massage, but you need to go through particular training to understand all the pathologies of cancer, the treatments, the medications. The next one is pregnancy. And again, similar thing. You want to make sure that you've got all the understanding of the anatomy and physiology during pregnancy. And as you know, we do a very good pregnancy massage course within Borough Education. And the last one is lymphedema. And this relates again to cancer massage, and you want to make sure that you're working with a lymphedema therapist, or you can go into training to become a lymphedema therapist where you'll be able to do lymphatic drainage massage, but then also do bandages and wrappings for lymphedema.
Communicating with your clients and other health professionals as a sports massage therapist. This is a great quote when thinking about communication. Ineffective communication is the most frequently cited category of root causes of sentinel events. Effective communication, which is timely, accurate, complete, unambiguous, and understood by the recipient, reduces errors and results in improved patient safety. And communication is key for what we do as a therapist, ensuring that the client really understands our thoughts, but also we can really listen.
What clients need to know before their first appointment. Firstly, they want to know what sports massage is and the benefits of massage. And this is important to go through with them, so know exactly what's going to happen in treatment, but also the benefits that sports massage might bring them. And that's about being honest with them and not making any claims that you can't prove, or giving them a simple term or simple version of the latest research that you've read, whether it's in a journal, in a book, or an article. The next one is letting them know what may happen during a treatment, which includes the clothing, and working on areas such as the glutes, inner thighs, or any other area that the client might feel quite sensitive. The next one is what to wear. And this is a really important one. And it's important to do this before your client comes and sees you for the first time. So they know if they need to bring shorts or sports kit with them, how to undress, and what areas to keep covered, as you or your client don't want any surprises. The next one is about putting them at ease. And it's really important, especially if they have never been to a sports massage before or had a previously bad experience in a massage setting. And you do that with the communication with them. So be clear with them what's going to happen through the whole of the treatment, what you're going to use in terms of massage methods, so just making them feel comfortable, and that will just help calm their system down, calm their nervous system down, and put them at ease. With the online form that you complete, make sure you have a good read of it beforehand, and if there's anything that really stands out to you in terms of contraindications, which we'll go through later, is you need to refer them on. And you want to do this with your client and let them know with some honesty, but try and avoid panic. And if there is a red flag that they do need medical attention, needs to be really clear with them that they do need to see whatever professional, whether it's their GP, whether it's the emergency room, but do this in a way that doesn't create any more panic. And the last one is build rapport and trust from the start. Now, this starts way before you see them. This is the communication when booking the appointment, the form filling out, and that rapport will take that journey through to be a long-standing client with them and provide a great service. And you need to do that from the very first time that they connect with you, whether it's online or face-to-face. So how to communicate with them. So firstly, it's using that pre-screen before their first appointment and making sure that they can fill that in with ease before they come and see you, so you can answer any questions, do any research that you need to do, or if you need to refer them on, you can do that also. Add in your terms and conditions. So terms and conditions is things like informed consent, it's your cancellation policy, all those things that your client needs to know and agree to before they come and see you. Give them a call. So build that trust straight away, and if something on the form needs more info, they get this from them before you meet them face to face. Agreeing the aims and objectives of massage. It's important to establish and agree these aims and objectives with the client before beginning a treatment. And this can start as part of the online form to begin with, and then before you go into any of the practical work within your face-to-face session. It does provide a part of your informed consent, and you want to make sure the client is happy with the proposed treatment plan. One example of this, if they come in with pain in a certain area, so it might be pain in the back of the neck and shoulders, which is obviously very common, you might want to look at the areas such as the chest, but you need to explain to them the reason why, so they're happy to begin with. Alongside that, it helps create excellent customer service to know what your client's aims and objectives are, and to agree to them and to meet them as well. And you can check back with them. So they said they wanted to feel less tense or reduce pain in the neck and shoulders, and you've done that at the end. You check back, you know you've done a good service, but also the clients had a great treatment with you as well. Communicating an etiquette with client during treatment. Let them know exactly what will happen in the assessment and treatment of sports massage. We've discussed this quite a lot as part of the module so far. Use non-scientific words and minimize any jargon. This is really important. Your client most of the time don't know, and most likely don't care that the vastus medialis oblique is a problem, but they do know that they've got tight quads, and it's using correct language but also non-scientific so they can understand what's going on. Spend time with them before treatment to build rapport with your clients and build trust. So that will be with the online form. It will be with a newsletter. You'll contact them regularly through a newsletter, and maybe a phone call if you need to beforehand. Use your knowledge as a therapist with credible information to demonstrate yourself as an expert. This is really important. You want to position yourself as an expert in your industry. You get clients to trust you more if you know what you're talking about and you demonstrate you know what you're talking about and you know what you're doing, and it's really important for that. Talk to your client through each stage of appointment and the reasons why you use the approach you do. So you don't need to use the scientific words and any jargon, but what you do need to do is let them know why you're using a certain technique. And sometimes clients do not care. They want you to work in silence. They just want a good massage. But some clients might want to know a little bit more. So depending on the communication you're having with your client in that treatment, just let them know you're doing the soft tissue technique because of this, as an example. Communicating an etiquette with clients outside of the treatment. You've got to keep in contact with your clients. This is so important from a follow-up care perspective, but also from a long-term client perspective. Providing that follow-up service allows you to ensure that they are doing the homework exercises and ensuring they're feeling great, and it also keeps you in their mind. So different ideas might be a personal message or an email or a newsletter. What I tend to do is 24 hours after their appointment, I have an automated email sent out to them, just checking in with them. And on that email, I also have a link to a testimonial questionnaire, just a review questionnaire about their treatment. If it met their expectations, did they enjoy the service, did they enjoy the massage, any other information they want to provide. Alongside that, if they want to, I always ask them, I add them onto my newsletter subscription, and my newsletter goes out at 10 o'clock every Thursday morning, and it has done for, I think I've missed maybe one or two over the last sort of 19-20 months. So it's really important that you keep you in their minds whenever they need you. And with massage, they might not need to come for a little while, but by having that regular contact with information that is useful to them, they're more likely to call you or message you when they do have a problem and they do need to have a massage. Communicating and etiquette with other professionals. There are times when you need to liaise with other professionals where you have a shared client, you work in a shared clinic space, or work closely together. You want to portray yourself as the best possible version, which includes how you dress, your body language, great written skills, but you also want to show that you're an expert in sports massage and with your knowledge and experience, but you also want to portray yourself as that person who knows when you need to refer to other professionals and build that relationship to get the best possible care for your clients. And this means that your client will get the best care, but also you can provide and create a good referral network with another like-minded clinician or health professional. Following on from that is working within your scope of practice and with other health professionals. As you know, it's really important to refer clients to other practitioners or clinicians when we know that we can't help them any further. And this develops the greatest service to the clients to make sure that they get the best care possible. So examples may be physios, osteopaths, chiropractors, podiatrists, sports rehab therapists, or personal trainers.
Working in your scope of practice and with other health professionals. Always work and act in a professional manner. That includes any face-to-face interactions, but also the language that you use in any correspondence with other professionals. Always respect the individual responsibilities, so the responsibility of yourself as a therapist, but also other health professionals. Be open to the opinions of others, especially when you're working with other health professionals based on their treatment and assessment of your clients. Be receptive to suggestions, comments, and constructive criticism, as this helps your own personal development as a sports massage therapist. Always respond to them in a timely manner and make sure that the records that you do keep are accurate, detailed, unambiguous, and consistent with expected best practice.
Communication protocols. Document everything. All methods of communication should be documented from the initial pre-screen, the signature of the agreement, to the detailed legible treatment notes after each treatment. All this communication with the client is to be kept safely and securely, as we mentioned in terms of following the Data Protection Act. And if you write stuff, write it in a legible way and always use a good spell check and proofread every piece of written information or content that goes to clients and other professionals. If grammar and spelling isn't your strong point, then I will get some help to do that with.
The advantages and disadvantages of verbal communication with clients and other health professionals. All messages are communicated immediately when working verbally. You can judge the reaction to your client when you convey any information to them, and it's more about a conversation rather than a one-sided interaction. And any doubts or misunderstandings can be identified and resolved immediately through that communication. The disadvantages are that there is a lack of evidence unless it is recorded. It also requires direct contact. And as I'm recording this in the middle of lockdown number 3, then that might be difficult when working with certain clients at certain periods or particular moments in time. Although it may be reasonable for the client, if you're working with health professionals as well, they may have time constraints that you need to consider when trying to meet and communicate verbally. And you can also exercise your personal influence to your client when speaking verbally, which may be a disadvantage and also an advantage. So it's important to be aware of your own biases when you're speaking verbally with a client. And the same, some advantages and disadvantages for written communication. A great advantage is there's no need for personal contact. So if you need to liaise with the health professionals or clients or send information through to them, you don't need them to be there personally for that communication to be transferred. It provides proof of future reference, so saving emails and documents provides evidence for that communication that has taken place. And it can be clear and self-explanatory, but it doesn't provide that communication, the two-way communication that verbal does. Disadvantage, it may be subject to delays in response. So you may email a client or a third party, and it may take 3 or 4 days for the answers to be sent back to you, which can delay treatment or recommendations. There are some confidentiality concerns, as it is possible for written evidence to be read by anyone, and that's why it's important for you to follow and adhere to data protection policies and GDPR when you're saving any written communication for between clients and yourself. Here is an example of a flow of a referral procedure if you feel like you can't help and support your client and need to pass them on to somebody that can help them further. So whether it's a physiotherapist, a counsellor, or somebody else that can help their goals and their needs more. So always begin with gaining informed consent. And then you can use that within the client record to then liaise with a healthcare professional. You want to make sure you gain informed consent that the client is okay with you passing information to that healthcare professional. And it's always important to get that in writing with an email to save that as evidence. You can then exchange the information from the client record with the referring healthcare professional, again, once you've got that informed consent. You can review the information, the treatment and assessment with your client before speaking with the healthcare professional. Once you've got information from the healthcare professional, if it is just advice and you can continue on treatment, whether you're working within a multidisciplinary clinic and you're having a chat with a physiotherapist, as an example, then you can use the information to review the assessment and treatment with the client and update that treatment plan. If they need to be referred on, then you can send their notes to that third party and liaise and connect the client with that third party. And then lastly, establish a method for updating the referring healthcare professional of any progress. So maintain that two-way communication that is important.
To truly make a difference in a sports massage treatment, it is not just about the techniques we apply, it's the whole environment. What we look like, our body language, our choice of words, the treatment room we are working in. And that whole environment will create a response in the client that either can make them feel more stressed and stimulate the sympathetic nervous system, or it can make them feel a lot calmer and promote more parasympathetic nervous system activity. So it's really important that you choose your environment, your words very carefully. Clients will base their opinion on a person or an environment within half a second, and that's super quick. So you want to make sure that the first impression of you is a positive one from the very start and start that treatment process well. And the final one in the communication section is dealing with complaints. Clients may become unhappy and put forward a complaint for many different reasons. And the most important thing is how you deal with it that matters. If you've ever been in a situation where something's not gone quite right, it could be within a restaurant or a shop, but you remember how they dealt with it. And if they dealt with the complaint well, it doesn't seem so much of a problem. But if they dealt with it badly or poorly, that's what you remember. You're less likely to go back and use that same service or product. So things to think about is listen to their problem. Just listen. Going back to that 2 ears and 1 mouth, and just listen what they've got to say. Try not to interject and just let them get their frustrations out. Note everything down. So write down details of the complaint as you're talking to the client. And then when you've done that, then offer a solution. With every client, we want to set the expectations for every part of the booking and the treatment process. And that's really important. So you set the expectations and the client knows what is expected of them, what's expected of you, and it also reduces any possibility for complaints that may arise. Get the terms and conditions signed before you begin any sports massage treatment, so you and the client are fully aware of what's going to happen within the treatment and massage process. And finally, further reading and resources on professional practice in sports massage. Thank you for taking the time to listen to this presentation, and please remember to complete your workbook on professional practice.